Good afternoon, everyone, and thank you for joining us for today's webinar. My name is Tremise Carter, and I am the Youth Engagement Manager at Eat Smart Move More, South Carolina. I am joined by Leslie Leek from the University of South Carolina, who has assisted with the evaluation of the PHEHP project. Today, we will share some information with you about engaging youth advocates through a program called the Healthy Young People Empowerment Project, better known as the PHEHP project. If you have any questions during the webinar, please type them into the question box and all questions will be answered at the end of the webinar. I joined Eat Smart Move More South Carolina as a Youth Engagement Manager in 2012. Prior to joining Eat Smart Move More South Carolina, I was the Community Education Assistant at Sexual Trauma Services of the Midlands and the Project Coordinator for the Building Dreams Mentoring Program. I bring a great deal of experience related to youth engagement, program development and management, and training and facilitation. Leslie will share some of her background with you later in the presentation. We have several objectives for today's webinar, and they are as follows. Participants will learn why it is important to engage youth advocates in policy, systems, and environmental changes, which will also be referred to as PSE change, related to obesity prevention. Participants will learn about the PHEHP project and how to implement a similar program throughout your organization. Participants will learn about ways to engage diverse community partners with the PHEHP project and why these partnerships are crucial. Participants will learn about the PHEHP project's evaluation logic model and evaluation results, and how to use the logic model to evaluate the process and outcomes for the PHEHP project. Participants will also learn about some challenges with engaging youth and community partners and lessons that we've learned while working with youth. Just to give some background on Eat Smart Move More South Carolina and the PHEHP project. The PHEHP project is a program within Eat Smart Move More South Carolina, and we are a private nonprofit whose mission is to advance community-led change to reduce obesity by making a healthy choice the easy choice for every South Carolinian. Our vision is a South Carolina where healthy eating and active living are central to the everyday culture where we live, learn, work, play, and pray. At Eat Smart Move More South Carolina, we have 4 focus areas, which are youth engagement, advocacy, community action, and consumer awareness. Through youth engagement, we engage, educate, and empower youth to become champions of change to create healthier communities. Most of our youth engagement efforts are implemented through the PHEHP project. We are currently working in 10 counties throughout the state of South Carolina. Our second focus area is advocacy. Eat Smart, Move More South Carolina advocates to influence policy, systems, and environmental change to support healthy eating and active living for all residents. We have an advocacy committee that works diligently on our advocacy issues. Some examples of policies that we've worked on include Healthy School Foods Bill, Open Community Use, and healthy vending in cities and counties. Our third focus area is community action. Eat Smart Move More supports and empowers local coalitions to implement obesity prevention strategies by providing technical assistance as well as tools and resources. And finally, our fourth focus area is consumer awareness. Our Let's Go South Carolina website provides useful information about both healthy eating and active living to South Carolina residents. Health professionals and enthusiasts write for our blogs, sharing ideas and ways to be physically active and eat healthier. Our health directory can be used to locate places like farmers markets, playgrounds, trails, and parks. And the Healthy Events page on the Let's Go South Carolina website lists healthy events such as walks and health fairs in different communities throughout South Carolina. So at Eat Smart Move More South Carolina, we really focus on policy, systems, and environmental changes. And I'll come back to the slide in a moment to talk about some of the difference between programs that we implement versus PSC changes. At Eat Smart Move More South Carolina, we help to make the healthy choice the easy choice by taking a PSC approach, and we work with a number of different partners throughout the state. We have over 2,500 partners throughout the state, and this consists of agencies, businesses, organizations, churches, schools, youth teams, and Eat Smart Move More South Carolina chapters. We also work with the South Carolina Department of Health, Department of Education, and Department of Transportation. So this map just shows where we have community coalitions, HEHP teams, and chapters throughout the state of South Carolina. Now going back to the PSC model that I mentioned earlier, we use the PSC approach because it often has the most reach. It allows us to reach disparate populations, and it's more sustainable to implement strategies at the PSC level. And it also focuses on prevention. One of the frameworks that we look at is the socio-ecological model. And I'll quickly go through each of the levels of that model. At the individual level, we're looking at the knowledge, skills, and attitudes of individuals. So that's dealing with one's preference, or if they know how to cook healthy foods or how to do certain physical activities. And then we move on to the interpersonal level, which really deals with the relationships that people have as well as their social networks. So are they engaging with people that promote physical activity or healthy eating? Thirdly is the organizational level, and these are the organizations that we participate in. So looking at our churches, work sites, and schools, different organizations throughout our communities. Looking at the community level, when we're affecting change at the community level, we're looking at the relationships between all of these organizations and how are we changing communities to make healthy choices easier. And lastly is public policy, and this could be national policy, state policy, or even local laws and regulations. And through our advocacy, we really look to address policy in different communities. Most of our efforts here at Eat Smart Move More South Carolina, and with our HEHP teams that I'll talk about in a moment, focus on the outer three layers of this model. And I'd briefly like to go back to this slide where we're looking at programs and events versus PSE change. So in the community setting, a program or an event would be something such as hosting a community bike ride. While looking at the setting for the PSC change, that would be implementing a complete streets policy. In a faith-based setting, hosting a Go Red Sunday would be more like a program or an event, whereas adopting a healthy meal policy within a church or a place of worship would be the PSC strategy that we would promote. And then lastly, schools. If a school hosts a fun night, that would be more of our program and events, but adopting a community open use policy is a strategy at the PSE level that we would promote. So why are we working with youth? There are several reasons why we work with youth and why we engage youth in this work. Modifying community policy systems and environments is recognized as one of the most promising strategies for combating obesity at the population level. And creating healthy communities require the interest and participation of multiple partners, especially youth. So we work with youth because youth can be a powerful voice on issues, but they're often overlooked. And when we talk about working with diverse partners in decision making, a lot of times youth are not brought to the table. Youth are our future, whether we're looking at in general or we're looking at the field of public health, youth are our future. Engaging youth is not only important and crucial for the community, but it's also crucial for the development of youth themselves. And we really look to a lot of youth empowerment models and different models such as positive youth development. So not only is it important for a community, but it helps to build youth themselves. Youth can offer a different set of skills a lot of times, and they also bring new ideas to the table that may not have been thought of. Youth can also state the needs of other youth because they're around each other, and they can capture the attention of decision makers and the media. Youth advocacy for obesity prevention has actually also been called the next wave of social change for health. So at Eat Smart Move More, we see the value in engaging youth. And like I mentioned earlier, we do this through the Healthy Young People Empowerment Project, also known as the PHEHP Project. Through funds awarded by the CDC in 2012 through the National Community Transformation Grant, the Healthy South Carolina Initiative identified youth engagement as its innovative strategy to create communities and make healthier communities. So we formed a collaboration through Eat Smart Move More South Carolina, the University of South Carolina, and South Carolina Department of Health and Environmental Control to develop the PHEHP Project curriculum. Since 2012, the PHEHP Project has been implemented over 30 times within different communities. We have trained youth in 25 of South Carolina's 46 counties, and we've had 600 contacts with youth going through our PHEHP program. The purpose of the PHEHP Project is to motivate and engage youth in policy, systems, and environmental obesity change efforts. PHEHP is designed to build the skills of youth so that they can become a greater voice in their communities. PHEHP activities focus on healthy eating and active living. However, youth are encouraged to use the skills that they learn through participating in the PHEHP Project to be lifelong champions of positive change. Many of our youth groups, they go through our training and they receive training related to healthy eating and active living strategies, but they've expanded to work on tobacco projects and just other issues that they've identified in their communities. So as you all may be well aware of, we're focusing on childhood obesity because this is a major public health concern. In America, there are approximately 1 in 3 kids that are overweight or obese. And here in South Carolina, 34% of our youth are overweight and obese. About 57% are not meeting the physical activity recommendations, and about 92% of students do not meet fruit and vegetable recommendations. And we know that youth who are overweight are 70% more likely to be overweight or obese adults. The PHEHP Project curriculum was based on several theories and theoretical frameworks, and they're listed here: the socio-ecological model, which I discussed earlier, the match model of public health and promotion, positive youth development, and other youth empowerment theories. And through a review of literature and developing the curriculum, we found 6 dimensions across the board and across multiple youth empowerment models. And this is a welcoming and safe environment for youth to have meaningful participation and engagement, for them to have equitable power sharing between both youth and adults, engagement and critical reflection on interpersonal and socio-political processes, participation in these socio-political processes to affect change, and integrated community and individual level empowerment. On the screen, you will see the PHEHP logic model, and through the PHEHP program, we're trying to make change and have influences at several levels, and you will see the different levels here in gray. So just looking at individuals and the youth that we serve, we're working to increase their knowledge and interest in healthy eating and physical activity. We're also trying to increase their skills and motivation for policy, systems, and environmental change. Moving along to the interpersonal level, Through this program, we look to build group voice, to build the relationships that youth have with adults, which is so important, and also group cohesion. And through that, we want youth to be viewed as resources and agents of change within our community. We work with a lot of adult coalitions across the state, as you saw in the map earlier. And as we implemented the HYPE project over the years, we want it to be natural that our coalitions and other groups that we work with look to youth as partners when they're making changes happen in their communities. And lastly, we want to have some sort of policy system and environmental change in the communities that we're working with related to obesity prevention. The HYPE curriculum has been structured to have 18 sessions, and I'll go through the phases in a moment. And the sessions have been designed to be instructed for 60 minutes each. However, we have seen lots of success with hosting 2-day camps for our youth teams, where they come to a training over the course of 2 days and they implement the first 9 sessions in the curriculum. And then when they leave the camp, they're ready to start identifying their projects. Our curriculum is evidence-based, and it provides opportunities for individual and group-based activities, and youth are able to meet on and off-site. Each of our HYPE sessions has been aligned with the CDC's National Health Education Standards, and when you view the HYPE curriculum at the beginning of each session, you will see which standard it aligns to. Our sessions are led by adult facilitators, and communities who implement HYPE receive both a youth guides for their youth participants and adult facilitators guides. So the HYPE project has 5 phases of youth empowerment, and they are think, learn, act, share, and evaluate. So during the think phase, youth are encouraged to think beyond the individual level and to consider the impact that one's environment can have on their health. Youth are thinking about food and physical activity stereotypes. There are activities about health disparities, as well as activities about changing policies in communities to create healthier environments. During the learn phase, youth have the opportunity to learn more about some of the basics related to healthy eating and active living. So they talk about sodium, sugar, and beverages and different things like that. They also learn about leadership skills and working with the media, how to engage the media. They practice public speaking through various activities, and they're learning about being advocates and champions for change during this phase. And these first 2 phases, as I mentioned, are phases that can generally be implemented over 2 days if a program doesn't want to spread the sessions out over 18 sessions. And here's our ACT phase, where the youth teams really jump into action. So based on the information that they're learning and thinking about, they receive cameras and do a mini photo voice project where they're identifying barriers in their community to healthy eating and physical activity. From there, they identify a specific focus area and create an assessment. Examples of assessments that we have used are the Community Park Audit Tool, the NIMS assessment, and Faithful Families assessment. After they complete their assessment, they go through their results to identify an issue and create an action plan for change. Youth also have the opportunity to share their efforts at our annual HYPE Summit, where all of the youth teams from across the state are invited to attend the fun day to present out on their project. And we also encourage youth teams to share their project locally. We've had youth to present to county council, school board members, directors of Parks and Rec. So our youth teams have really been able to create opportunities to identify key decision makers in their community. They also share their projects and get input from local community members. For example, we have a group that is planning to host a community cipher in which community members will come together to talk about a walkability assessment that they've recently completed. And then evaluate, which is an ongoing process, and Leslie will talk more to our evaluation efforts. We really want the youth team to look at what they were able to accomplish, and also we evaluate the program to help us improve the program for future HEHP teams. I'd like to take a minute to briefly share a couple of our success stories that we've had with implementing the HEHP project. In Lawrence, South Carolina, we've worked with a group through Bridging the Gap Advocacy. And this is a very active HEHP team who was able to successfully partner with their local Healthy Eating and Active Living Adult Coalition. Their project included advocacy for a safe passage near their local middle school, bringing awareness to hemophilia through participation in walks and runs, planting a garden, revitalizing a community baseball field, and promoting community buy-in through cleanup events. The youth team completed a walkability assessment and presented their results to their county council, requesting that the county council help to make the area surrounding their local middle school safer for students to walk by considering the adoption of sidewalks, street lamps, or stoplights, as well as signage. Thus far, warning signs and a flashing light, which you can see pictured there, has been installed in that community. Then again, the youth team also hoped a community cleanup day to get local buy-in, and they were able to give produce from their garden to 70 residents. This team was able to apply for different funding opportunities, and as you can see at the photo at the bottom, they were able to fix the fencing at a local ball field, as well as have bleachers repaired and trash cans added to help promote physical activity in that community. The next success story I will share is from Anderson County, South Carolina. This is another group that received multiple funding to implement their project due to success of a previous grant opportunity. So in their initial project, they worked at a park called Equinox Park. And as you can see in the top two photos, they host a community cleanup day where they painted the playground equipment, removed some graffiti from off the playground equipment. They provided trash cleanup, they completed some mulching and yard work, and they also installed some benches. And due to their successes with that project, they were funded for an additional project. And through their park assessment, they wanted to look at accessibility and making the playground ADA accessible. So they were able to get approval to have an ADA accessible sidewalk. And you can see the construction of the sidewalk in the bottom photo added to that local playground. Now I will turn the presentation over to Leslie, who will go into some more detail about the HEHP project evaluation efforts.
Okay, hey everybody. As Tremaine said, my name is Leslie Leek, and I started working for the Corps for Applied Research and Evaluation 3 years ago, and I like to call it CARE because that's a mouthful. And CARE is a research office within the School of Public Health at the University of South Carolina. I started as a graduate assistant there, and now I work full-time for CARE as a program evaluator. I have a master's in public health from the University of South Carolina, and I'm also a certified health education specialist. So my evaluation team and I had the opportunity to learn about the HEHP project through the evaluation of another project that Eat Smart Move More South Carolina coordinated called the Let's Go project. And Let's Go had multiple components, but one of the components involved implementing HEHP teams in 6 counties across South Carolina. And I'll share some of the findings from that evaluation later on. But the first thing that we did to evaluate HEHP as a standalone project was to develop an evaluation logic model. The evaluation logic model is a visual guide that maps out program inputs and outcomes similarly to a program logic model, but it also maps out all of the associated evaluation activities. We always start with an evaluation logic model because it really forces everyone to think through all of the details of the program up front, which just helps get everyone on the same page and get really clear about what the program is going to look like. The evaluation logic model also serves as a reference for everyone throughout the project. It reminds us all of the big picture and the reasons behind all of the program and evaluation activities that we do day to day. There are a lot of different ways that a logic model can look, and keep in mind that I'm a full-time program evaluator, so I have the time and the background to really build a detailed logic model. But I hope that if you all, or when you all implement HEHP, you'll create an evaluation logic model as well, and just keep in mind that it doesn't have to look like this one. So I've included some screenshots of the logic model in the slides. But if you'd like to see the whole document, you can email Tramiz after the webinar and she can send it out to you. So looking at the table on the slide, the first thing that we consider when developing a logic model is the chain of events of the program. And we worked very closely with Tramiz to really walk through the context of the program, program inputs, implementation activities, and the expected outcomes. And as you can see on the table, there are a lot of little pieces within each of these categories. So I'm just going to give a brief overview so you have a better understanding of each. You'll see in the first column context. Context is the environment surrounding the program. It's things like the political climate, funding, your target audience, partnerships, etc. And the context really just helps paint the big picture of what's going on. And then we look at inputs, which are the activities and resources that aren't necessarily part of the day-to-day implementation, but are things that you definitely need to successfully implement a program. So this includes the upfront work and resources, things like funding, equipment, manpower, etc. The next thing we consider on the logic model is implementation activities. And implementation includes the actual sort of day-to-day program activities, which in this case is recruiting youth and adult advisors, regular HEHP meetings, the HEHP curriculum, for example. Once we consider all the things that go into the program, we look at what are the expected outcomes of the program. And these individual outcomes are the outcomes that you'd expect the program to have on the youth and the adult advisors who are participating. Things like increased knowledge, more social support, or healthier eating habits, for example. Then we look at community outcomes. So the outcomes that you'd expect the program to have on the community at large. And some outcomes, some community outcomes will depend on whatever projects that the HEHP youth implement. But generally, you'd expect the projects to increase access to physical activity or healthy eating or both. And hopefully, there will also be an increased value placed on youth leadership in the community. You'll see that we included health outcomes on the logic model because ultimately, we do hope that things like healthier eating and increased access to physical activity will lead to improved health. But health status isn't going to change within the time frame of the program. You can't reduce the obesity rate of a community in a year. And so it's really beyond the scope of the evaluation, but we include it just to remind ourselves of the ultimate goal. So once Tramiz helped us understand the program inputs and outcomes, the evaluation team then considered what exactly we needed to measure. So for example, one component of implementation is that initial youth training. So we wanted to be sure that we evaluated the training. Another example is that an expected outcome is that youth will have social support from their peers. So we really want to make sure that we're evaluating peer-to-peer dynamics during the program. And then you'll see in the last row on this slide the time frame. So we have to consider when we're going to measure each of these things. And the next step in our logic model is to consider where all our data will come from. So we really need to consider what information do we get from the youth, what information do we get from staff at a supporting organization, or what do we need to know from community members at large. And then the very last thing that we map out is what tools we're going to use to gather what data. And so that's the last row here that you can see on this slide, that row that's titled measures. And you'll notice that the items in that row are color-coded. So we designed an ideal evaluation if resources were unlimited. This is the evaluation that we would do. But in reality, the project doesn't have the budget to hire evaluators to do all of these activities. So we've color-coded the items here just to show who we suggest collects what information. As I mentioned before, we were able to collect some data as part of another project evaluation. And you may be able to do that too, actually. So for example, if you're going to use HEHP as the youth engagement component of a larger grant, you may be able to use that grant funding for the evaluation. Or if you partner with a community organization, they may want to collect information on their own about the project that you can also use for your evaluation. And a lot of the data that you need for evaluation will just be collected as part of the program. That's the stuff in red here. So for example, taking attendance at your meetings can tell you things like about attrition or participation. Demographic information from an application can let you know if you're reaching a representative group. If you take notes or make checklists for yourself during meetings, you can tell whether the program is being fully implemented, for example. And if you don't have the resources to collect all of the information that you'd like, then I suggest considering hosting a student, like an intern or a practicum student who can help collect data. We have been fortunate enough to work with a couple of really great students, and I'll share some of the work that they did in just a minute. But the activities that they helped us with are highlighted in blue here. So that's just an overview of the logic model that we created. And again, I just want to recognize that we all have different evaluation experience and we're working with different resources. And so I really hope that I've given you an idea of what a logic model can look like, but keep in mind that every program is going to be a little bit different and the logic models will look different too. So once you have a logic model, the next step is to start developing the measurement tools that you're going to use to evaluate your program. And so that's things like training evaluation surveys, meeting checklists, attendance sign-in forms, etc. Once you have those tools, you can start collecting the data. And the most important piece of evaluation is what you actually do with the data once you have it. So the information that you're collecting for an evaluation is really intended to improve the program implementation and outcomes. And so it's important that you actually incorporate the findings of any data that you get. So I just want to share a couple of the tools that we use to collect data, the things that we assessed with the tools, and then some of the findings. The first program component that we evaluated was the youth training. We developed a survey that was given to the youth immediately following the training. We originally intended to give the survey to youth following the training and then again at the end of the program. But we realized that there was a fair amount of attrition in the program because of how hectic youth schedules are. It's just hard to schedule youth, it's hard to schedule everyone to get together when everyone's busy with end of school exams and soccer practice, etc. So we ended up just giving the survey to the youth immediately following the training. And we adapted the survey as we went. So we've given several iterations. But in general, the surveys assessed youth's current health behavior. So things like what kind of food they eat, how often they exercise. We assessed their previous experience with advocacy. We also asked them questions about the level of empowerment that they felt following the training. We looked at their readiness to start the next phase of the HEHP curriculum, and then we just got their feedback about the training itself. We got a lot of good information from these surveys, but some of the key findings were that youth really enjoyed the training activities that got them up and moving and let them be physically active. They also reported that after the training, they really felt ready to start the next phase and to get into action. And lastly, they reported that after the training, they'd gained skills, knowledge, and confidence. So as I mentioned, we were lucky enough to have a couple of students help us with the evaluation. And the first student that we had help did a case study of the HEHP project. She collected information several different ways, including interviews with the adult advisors and some document review. And because this was a case study, she really explored the HEHP project in depth, and she assessed many different things. And so some of the key things that she looked at were what characteristics of an adult advisor indicate success for the program. She also looked at the youth recruitment process and the program's impact on local decision makers. The richest information that she gathered was about the qualities of a successful adult advisor. She found that having a passion for youth or healthy living, being dependable and organized, being able to encourage youth, having a pre-existing relationship with the youth, and having existing connections in the community were characteristics that really indicated success. But she found that in most cases, a single adult advisor did not meet all of these criteria, but as a whole, adult advisor teams tended to meet them all. We also had a student conduct interviews with youth who had finished the HEHP program, so HEHP alumni. He was able to conduct 30-minute interviews with 3 different youth who had finished the program. And in the interviews, he assessed their perceptions of the adult advisors. He gauged their overall experience with the HEHP program. He assessed any long-term personal impacts or behavior changes resulting from the program. And then he sort of gauged some suggestions for improving the program. He found that the youth he interviewed had made sustainable lifestyle changes as a result of the program. And interviewees reported that they continued to apply the information and skills that they had learned after the program was over. It also seemed like the projects that the youth had implemented were still being sustained in the community. So, for example, a church within the community was still following a healthy food option plan that the youth had provided. But one interviewee did mention feeling like the momentum towards positive change in the community had tapered off since the program ended. The last two, sorry about that. The last 2 evaluation activities I want to share with you guys were those that were part of the Let's Go project that I mentioned earlier. And for that project, we were able to conduct focus groups or focus group type discussions with some community coalitions who had partnered with the HEHP teams to implement some projects in the community. And we also did some in-depth interviews with community stakeholders who had somehow been involved in those projects. So we really wanted to assess the outcomes of the different HEHP projects on the coalitions and on the community. And these 2 methods are how we learned about those success stories in Lawrence and Anderson counties that Chermise mentioned earlier. And so I think she gave a great description of the successes in those counties. And from an evaluation standpoint, we were really just able to see how the HEHP team's projects led to additional funding and additional efforts to improve the community, which really speaks to the impact that empowered youth and just a little bit of money can have. And so that's really all I wanted to share with you guys about the evaluation. If you have any questions for me, you can type them into the chat box. And I'm going to turn it back over to Termise to wrap us up.
Thank you, Leslie.
Thanks.
So as I wrap up the presentation, I just wanted to talk briefly, and I think Leslie covered most of that, about some lessons learned. So one thing that we found from implementing this program, and many of you may know working with youth programming, is that adult advisors can really make or break a HEHP team. Even if it's not just that one person, but if you have a team of people that meet those characteristics as a group, that's really important, especially if you're establishing a new group of youth to implement the program. Having adult advisors who have a commitment to engaging youth, who work well with youth, and who are able to take the lead in the project. Because the way we implement the program here is we provide technical assistance for communities, but it's really up to the communities at the community level to implement and successfully implement their program. So having that local leadership is very important. Another thing that we learn is scheduling. Working with over 30 HEHP teams across the state. One thing, if it's not an existing group that already meets, and if it's a group that comes together to implement the program, being mindful of scheduling and how that can affect your programming. Students who play sports at different times of year may be on your team at one point, but then not another point. We've worked in a lot of small rural communities. So when you have about 6 youth who are related, a death in the community could be half of your youth team. So that's one thing we really found was just being mindful of scheduling and trying to work around it and meet the communities where they are and still make things work. And that really led to us having the 2-day camps where youth can quickly go through the first half of the curriculum and then begin working on their projects. It's not so much as an issue for youth who already belong to an existing group, but if you're pulling together a new youth team, that's something to consider. Another thing is incentives. Through the HEHP project, communities receive small mini grants when they're implementing, and a part of that budget is for incentives. And adult advisors just explained that they look forward to getting their HEHP points and building up their incentives and using their incentives. Communities use their incentives in different ways. Some communities liked, their youth liked like individual gift cards and different things like that, while other communities rather pool their money for the incentives together, and they were able to take their youth on a trip, for example. And then lastly, what we found very important is the physical activity component. Whether it's our youth summit, whether it's HEHP sessions, youth like the opportunity to get up and move while they're in our sessions. So each of the HEHP sessions, we build in physical activity breaks in the curriculum where it'll tell you to stop and do your physical activity. Some are already outlined, others allow for a little flexibility and the youth can pick whatever the activity is. But anytime we have something, we try to have jump rope, hula hoops, frisbees are big, just to get the youth up and moving. And we found that to be very helpful. And through our evaluation, youth have always noted that. So the last thing I'll discuss is sort of what we can provide to communities that are interested. In 2017, we had the opportunity to be in Kansas City and train groups from Missouri as well as Arkansas in the HEHP Train the Trainer. And that's one thing that we are able to offer communities. If you have organizations within your state or that's a part of a network who are interested in having their adult advisors trained in the curriculum, we are able to come facilitate a 2-day training with adult advisors who can then go back out into their community and train either youth or advisors at their state in their organization. The second option is the HEHP advisors training as well as technical assistance for HEHP implementation. And this will just go into a little more detail. It's a little more hand-holding at this level. So we will help communities look at how to recruit their adult advisors and youth team. We will share information about the implementation structure and really help work through that. If weekly sessions are best for your community, or would it be best for your community to host a 2-day camp or a 1-day camp to go through the curriculum? And even looking at project implementation, we can provide assistance when youth identify their issue. We can help best pick which assessments to use and how to walk them through project planning. And then lastly is speaking engagements. We've had opportunities to present Eat Smart, Move More and the HEHP project across the country, and we're always open to speaking engagements or summits, whether it's for youth or adults who are working with youth. That concludes our presentation. We are on social media. If you are on Facebook, Instagram, Twitter, or Pinterest, please follow us. Our handles and usernames are there. And at this point, we will answer any questions. If you have questions for either myself or Leslie, please type them in the question box, and I will go through and respond to any questions that you may have. If you're interested in implementation, please take down my email address, phone number, and you can call me to talk a little more about how to bring the HEHP project to your community. And I see some questions coming up now, so I will begin responding to them and sending the responses out to the group. So someone asked what healthy eating, what HEAL meant. That's healthy eating and active living. So that's an acronym that we use here for healthy eating. How are trainings funded? Eat Smart, Move More South Carolina has partnered with several organizations, and we've received grants to implement trainings. And normally in our grants, we write in for the training costs to implement as well as the community grant. So we've been funded by South Carolina DHEC, the Blue Cross Blue Shield of South Carolina Foundation here in South Carolina. Mary Black Foundation has funded us. So we receive a number of grants to implement the program. We've also had communities to purchase and sponsor their own implementation of the HEHP project. Let's see, is the adult advisory training for agents to take back to their community to train adults, or is it to work with youth? So we've had it work a number of different ways. Some groups have taken the training back and they've been able to train adults in their community to work with youth, while other groups actually have sent individuals who are able to facilitate the curriculum to their youth team. So the way the adult advisors training is set up, you could train youth at your site who are implementing, or you could train youth directly. What is the cost of the training? That will vary based on your community, how many people you would invite to the training, if you're just wanting the TLT, or if you're wanting more technical assistance. If you are interested, you can shoot me an email and I can get some more questions from you based on what you're looking at doing with your training, and we would be able to send you a proposal for training at that point. How can we obtain the curriculum? We have copyrighted the HEHP project curriculum. However, I can send out a sample session from the curriculum if an individual is interested in looking at how a session is structured, and if a community wants to implement the curriculum, then we would train them in the curriculum, and then they would have access to both the youth and facilitators guides. States can purchase an implementation program facilitator. Yes. So states can purchase the implementation and program facilitator guide as well as the training. And like I said, if you're interested in getting the HEHP project in your community, please email me and I can follow up with you to get more information about what you're looking to have, and we will send a proposal based on the information that you provide. So we've gotten through all the questions that I've received so far. I'll leave it open for a couple of minutes if there are any additional questions. And I'll also just send a response to these questions out via email as well so that you can have them. So like I said, I'll stay on the webinar for a couple of minutes, but if you don't have any more questions, I would like to thank everyone for joining us and learning about the HEHP project. And please contact me if you're interested in a similar program or the HEHP project in your community, and we can discuss ways to get you all started. Thank you.